Welcome this morning. It's nice to see you all. Thank you for being here to learn a little bit about pain management without the use of opioids, and specifically I'm going to talk about non-pharmacologic interventions. So this isn't taking any medications at all. These are things that we can do that don't involve medication, okay? And so sometimes that might feel like the hippy-dippy woo-woo version of how to cope with things, but everything I'm going to tell you today is based in science and has gone through the same clinical trials that many of the medications that you take have gone through, with some pretty amazing results. So my hope is by the end of this, you're going to walk away with a couple of new tools to use. We're going to practice some stuff in here. It will be very low-key, won't ask much of you. So thank you for being here. I'm Dr. Ginny Maril. I'm a licensed psychologist, and currently I work out of Los Angeles area at the California Lutheran University. I'm an animal lover, as you might pick up from the pictures in this presentation. I'm also the daughter of a Scleroderma patient and a Scleroderma caregiver. So that's really my connection to this illness. So very importantly to start, I want to talk about who I am not. Anybody know who that is? That's Professor McGonagall, right, from Harry Potter. And she is a wizard. And I'm not a wizard. So what I am going to give you is a lot of great information today. Nothing that I can share with you is a magic fix that is going to make you 100% pain-free. But what we're going to do is try to learn some tools and to discuss ways to lessen your experience of pain and really improve the quality of life and of psychological health. Everything on this chart has been proven to help relieve pain. Okay? That's not in every person who does these things or has experienced these things, experiences pain relief, but all of these have been shown to relieve pain. So therapy, deep breathing, reducing stress, taking care of ourselves, whether that's exercise, making sure we're sleeping, making sure we're eating as well as we can, maintaining good relationships, a meditation practice, tracking our pain, biofeedback, massage, practicing self-compassion and mindfulness. And all of these things, you'll notice, don't involve medication, right? None of them do. And so how is it that these things then can work to reduce pain? And this is a very simple explanation of a very complex thing, but if you are interested in it, you can Google the gate control theory. And what the gate control theory tells us is that non-painful input closes the gate to painful input. So if we can have some non-painful stimulus, that's going to shut down those pathways that pain is usually going through. So that prevents the pain sensations then from going to the central nervous system. So again, Google gate control theory, and you can learn all about it, everything you'd ever wanted to know. But that's basically what all of this is based on. And you might have had an experience where you were in a lot of pain, and then you started doing something, or you started watching television, or you started getting involved in something else, and you're like, well, oh, I'm not hurting anymore. That's essentially what it boils down to. So I can't talk about all of these things today, but we're going to just take a sampling of some things. And these are the 4 things that we're going to talk about. I'm going to practice and learn to do deep breathing. We're going to learn and talk about mindfulness. We're going to talk about meditation. And finally, we're going to wrap up with self-compassion and combining mindfulness, meditation, and self-compassion in just a quick meditative practice. You won't even have to leave your chair for it. It won't require much of you other than sitting and being here with me and listening to me talk. So let's start with the basics. It might seem funny to talk about breathing, but it is one of the most helpful things that we can do to ground ourselves, to reduce pain. And this is how it starts. I know that everybody in this room is currently breathing, but what we want to do is do a deliberate, focused breathing that's going to trigger the relaxation response, okay? So I'm gonna walk through this, and then we'll just practice it together. So it's important to find a comfortable position. And you want to just place one hand on your belly and one on your chest, because we breathe in different places, and we tend to breathe up in our chest, which means we're breathing more shallowly. If we are expanding our belly, that means we're doing full, deep breathing. So if you take one regular breath, you inhale that, you're gonna feel your hand rise with your belly, and that's how you know you're doing it right. And if you can, hold it just for 1 or 2 seconds. And then slowly breathe out your mouth. And it's just a relaxed breath out. It's not, you don't need the whooshing sound out of your mouth, anything like that. And then you just repeat. So we're gonna make sure that our belly is rising and falling, not necessarily our chest. And something like this can be really helpful to focus on. So this is a breathing pacer. You can Google breathing pacer GIF, and it's gonna pull you up a number of options. And this one is my favorite. And this allows us to pace our breathing, like we just learned, that breath from the belly. When it expands, that's our inhale. And when it contracts, that's our exhale. It's also kind of a bonus because it's a little bit hypnotic and it's nice and distracting, right? And so that kind of helps us trigger that relaxation response. Now, laying on the couch watching Netflix, yes, you are breathing, but you're not triggering the relaxation response. So this is really meant to be a very focused practice and one where we're paying attention to the breath. What the relaxation response does is slows your heartbeat. It relaxes your muscles, slows your breathing. It decreases your blood pressure. It also increases nitric oxide in the blood. That's really important because nitric oxide is what is important for vasodilation. That means it relaxes the inner muscles of our blood vessels, causing them to widen and increase circulation. And we know with scleroderma, if we can get any help in vasodilation, we'll take it, right? So it also allows nutrients and oxygen to get to every part of your body more effectively, more efficiently. A low production of nitric oxide is actually associated with diabetes, with heart disease, with erectile dysfunction. So again, if we can increase that nitric oxide in our blood, we're doing ourselves a favor. And yes, I'm telling you that all you have to do is breathe to do that, right? So breathe in that relaxed way. With this pacer is very helpful. And we can notice a difference. Just doing this kind of abdominal breathing for 20 to 30 minutes each day reduces anxiety and it reduces stress. Guess what? If we're less anxious, we're more relaxed, our muscles are less tight, usually that means less pain, right? So there's a bit of a snowball effect with this too. We know that this deep breathing also increases the supply of oxygen to our brain, stimulating our parasympathetic nervous system, which promotes a state of calmness. So if you've ever been to a yoga class or you went to any of the yogic breathing that was here this weekend, that actually gets you to the relaxation response, and it gets that sense of calmness. It goes straight to your parasympathetic nervous system. Even when you sigh, that actually releases or relaxes your parasympathetic nervous system. It's like magic, but it's science. It also helps you feel more connected to your body, and it brings your awareness away from the worries in your head, quiets your mind, puts us in our body versus in our head where we can really get lost sometimes. Okay, so that is breathing 101. And guess what? You can do that anywhere, right? You can keep doing that this whole presentation if you would like. So this next piece that we're going to add to the breathing is called mindfulness. And I think a lot of people have been hearing more about it, which is exciting. But I want to talk about essentially what it is. It sounds simple. It's a little bit harder to put into practice. So mindfulness is paying attention on purpose, in the present moment, non-judgmentally. Again, easy to say, a little bit trickier to do because we have to figure out how to do this, and different folks are going to have a harder time with different pieces of this, right? So for some people, it's hard to stay present. It's hard to just keep thinking about what's going on right now. For other people, it's the being non-judgmental, right? If we get stuck in our head and we're our own worst self-critic, we're going to be stuck with a lot of those critical thoughts. So trying to back off the judgments, that might be harder for you. So we're going to talk about meditation, but I want to introduce mindfulness first because we're going to learn about mindful meditation specifically, which has a lot of impact and influence on pain reduction, okay? So keeping in mind mindfulness, paying attention on purpose, in the present moment, non-judgmentally. Okay, so Dr. Maril, this sounds like a bunch of hippy-dippy woo-woo stuff. Why do I want to be mindful? These are all the reasons why. We know it reduces pain. It increases our ability to cope with chronic pain. It decreases the symptoms of anxiety, depression, hostility, and the tendency to turn emotional pain into physical pain. And we know that scleroderma is linked with each of those things that I've just mentioned. It helps us manage stress more effectively when it happens. If we practice it more, then we get better at relaxing. We don't have to practice as much. We get a little bit quicker. It can increase our energy, it improves our self-esteem, and it helps us learn to cope more effectively with both short-term and long-term situations, right? Scleroderma is typically a pretty long-term stressful situation, right? So I think this is a really nice complement and a really nice intervention to use. Okay, so how then do I be mindful? I'm glad you asked. I'm going to tell you. So it's going to start just by simply looking at this picture. And it's about noticing things we might not normally notice. We can look at this picture and think, oh my God, somebody needs to cut that grass, right? And maybe that fence needs fixed, and oh my gosh, I wonder if there's even gas in the lawnmower. Maybe it needs oil. When's the last time we even tried to start it? Is that gonna work? Maybe if it's electric, somebody's chewed, clearly there's rats living in there and somebody's chewed through that cord. Okay, I can look at that, or I can look at this picture and be like, oh, a rose. Right? Because there's also a rose in this picture. So part of mindfulness is about noticing what we notice. If we look at things and we notice all the things there are to do, if we notice all the things that are negative, we're going to get really, really good at focusing on what is negative about situations and how much there is to do about situations. Whatever we water is what grows, right? That's garden philosophy. If you're watering something, it's going to thrive. If you're not, it's not. Okay? So if we're essentially watering our ability to see what's negative or to see, what needs done, then it's going to be harder for us to see that rose. Mindfulness is going to encourage us to see everything that's there and notice what we're noticing. A lot of times we aren't present, right? We're not noticing what is present. We're thinking about what's happened. We're worrying about what's going to happen, what might happen. Again, it's totally normal. It's a natural thing to do, especially if we have something really stressful happening in our lives. We're going to worry about it. Okay? But if we spend too much time worrying about what's happened in the past, we're going to tend towards depression. If we're worrying too much about what's happening in the future, we're going to tend towards anxiety. And neither of those are helpful for us, right? And we really need to focus on staying present, which is one of the major pieces of mindfulness. So that might sound super easy, but it's not. It's really about training our attention. Our minds wander about 50% of the time, okay? That's just what our brains do. But every time we practice mindfulness, we get better at it. And if we can take more control over our attention, we can choose what to focus on, right? And we'll have more control over our emotional responses at any given moment that takes us away from the present. And we'll have an easier time getting back to it. What we're doing is structurally changing the brain to be better at present focus. We've built these neuronal pathways over years and years and years and years, sometimes decades of thinking a certain way, right? So it's gonna take a little bit of working on our brain to figure out what this new pathway is and to literally build these new neural pathways, these new ways of thinking. But we know that's exactly what happened. It also means acknowledging that our brains are typically on automatic pilot. You might think about those times when you have driven all the way home and you get to the driveway and you're like, meh, how did I get here, right? That's automatic pilot. And we do it all the time. We are typically always on autopilot. And when we're on autopilot, we're not paying attention to how we are, and we're way more likely to have our buttons pressed. So if somebody kind of catches you off guard and you're not in your body at that moment, you can be caught off and you might be snappy or irritable or react in a way that was like, oh, that was a little bit too much for what this situation calls for. But if you're present and aware of what's going on, that's going to work a little bit better. You're going to have more control over that. And we know anytime that we're invoking strong emotions, that can be emotionally and physically painful, right? And that's what we're trying to avoid. So those thoughts and those feelings that we're barely aware of might trigger something unhelpful, habitual ways of thinking that don't really benefit us. And when our mood isn't great, we don't feel great. Everybody can think about that link between how you're feeling emotionally and how you're feeling physically. And if one isn't great, it's usually impacting the other, right? So by becoming more mindful, we give ourselves just more freedom and more choices and more control, and not going into those same ruts that we have always gone throughout the past, okay? So I'm going to show you another picture, and we're going to be mindful together. This is going to be another mindfulness practice. It's a very dramatic opening to the mindfulness practice. And I'm going to ask you just to take a minute and notice what you're looking at. And you're like, oh my gosh, Dr. Maril, you're making me look at a flower. Trust me. What do you see? Some rain, flowers, the dew on the flower. A dahlia. Oh yeah, it kind of looks like a fish. I've never noticed that before. Yeah. Oh, that's really cool. I've never noticed that before. That's great, thank you. So we're looking at this and we see a lot of colors, right? We see the yellow that fades into the white, that's moving into a light pink, and we finally get to like that dark pink. Yeah, there might be something going through the center. And so this is what mindfulness is asking us to do. We're slowing down. We're just taking a look at what's going on right now. We're not judging what we're seeing. We're just being here in this present moment, paying attention on purpose, without judgment. So what is really common to happen is I can be looking at this and I think, oh my gosh, this is such a beautiful flower. It's so pretty. There's so many colors. And oh, I bet like hummingbirds and bees would love to hang out on this. And oh my gosh, what if there were a bee? And what if I'm allergic to bees? And then what if I got stung? And then what if I don't have my EpiPen on me? And then I can just completely spin out, right? And this is where the non-judgmental part comes in. We don't have to judge that it just happened because I've already told you that our mind wanders half the time. That's okay. When our mind wanders, it's just a reminder for us to come back to right now. Okay? And I don't have to worry about the bees or my EpiPen. I just need to be here right now looking at this. So the cool thing about mindfulness is that we can do it anywhere. We can eat mindfully, which is really great for scleroderma patients that sometimes need to slow down and eat anyway and really pay attention to what's happening and giving our GI tract that could be very sensitive just a little break and a little kindness. You can do mindfulness while doing dishes, vacuuming, walking, and meditating, which is what we're talking about. So when I talk about mindfulness, remember, it's just being present. It's just being present right now, paying attention right now to the lines in the floor as I'm vacuuming, or the sound of the vacuum, the way it feels in my hand. Slowing down, paying attention, present moment, without judgment. Again, not easy, but extremely, extremely helpful, especially when we're going to pair it with meditation, okay? So I'm going to talk a little bit about meditation. I'm going to talk about how we pair mindfulness with meditation and how that ends up helping us, and specifically helping us with pain. These are all the magic things that meditation does. So it helps our brain, actually, as we age. A study out of UCLA found that long-term meditators actually have better preserved brains than non-meditators as they age. And even people who had been meditating for 20 years actually physically had more gray matter compared to people who have not been meditating. Meditation actually decreases that automatic thinking that I was talking about. Okay. A study out of Yale recently said that when we're not thinking about anything in particular, our minds just wander from thought to thought, and that is actually associated with being less happy. Okay. So if we can be more present and more deliberate, we're going to be a little bit more happy. What I think is super cool, a study out of Johns Hopkins validated the idea that meditation reduces depression and anxiety. And so they had an identical effect size in reducing depression as antidepressants did. So meditation and antidepressants had the same impact on depression and on reducing depression. So I think that's pretty amazing. I think that's pretty cool. Again, that's not even taking a single pill, and a lot of scleroderma patients I know don't want to take another pill. So maybe meditation is a good fit for you if you're experiencing depression. There's also this idea that meditation is like this passive thing where we have to totally clear our mind of everything, and that's not it at all. It's actually an active training. It's an active way of thinking that we'll talk about. We've seen that meditation actually changes different areas of the brain in addition to gray matter. So we've seen that it increases the cortical thickness in the hippocampus, which governs learning and memory. It also decreases brain cell volume in the amygdala. Our amygdala is responsible for kind of like our fight, flight, or freeze responses, heavily involved in anxiety. It's heavily involved in a trauma response. So, and responding to stress. So again, meditation is decreasing this. If we're decreasing stress, there's a good chance we're decreasing pain. Meditation also improves concentration and attention, and also can aid in recovery from addiction. All of that, I think, is just really, really cool. So when we combine mindfulness and meditation for mindful meditation, we're just really starting to see some really neat things. So mindful meditation has been shown in clinical trials to reduce chronic pain by 57%. So these are the similar clinical trials to what our medications are going through. Experienced meditators showed a reduction rate of 90%. So this stuff is golden. It's good. And we're starting to do more imaging studies, so we're watching what happens physically in the brain as people do mindful meditation, and we are watching at calm brain patterns that underlie pain. So over time, that's structurally changing the brain and how our brain responds to pain. It changes the intensity at which we experience pain, and essentially it turns down the volume on our pain. Again, I think this is really magic. A great resource if you're interested in this, there's a book, and it's an 8-week course to teach you mindful meditation for pain reduction. It's called You Are Not Your Pain. So if this is something that is speaking to you, I would recommend that. There are also a ton of really great apps on your phones right now. So if you have a smartphone and you're interested in what I'm talking about, these are all ones that I would recommend. Most of them do have free options. Some of them have, a monthly subscription, $2.99, $3.99, or you can buy a whole year for $30 or whatever. So it's a little bit of an investment, but something I think is well worth it. Again, if this is speaking to you and you think you'd like to integrate meditation and mindful meditation specifically into your life. So we have Calm. That's absolutely wonderful. You can just hit a button and it will help you meditate for like 5 minutes if you would like. Pacifica, this is like having a therapist in your pocket. Essentially, this is cognitive behavioral therapy in your pocket, which has been proven also to be very helpful with treating pain. Breathe to Relax is really helpful with learning to breathe and practicing breathing. That was developed by the VA. Then we have Insight Timer and Headspace. So these are really the most popular ones and the ones that I would recommend if you would like to keep this sort of stuff just in your pocket. Okay. So we've now talked about breathing and mindfulness and meditation, and now we're going to add one more thing, okay? And that is going to be self-compassion. So if you could humor me a little bit. And if you can think about, just get somebody in your head, somebody that you really, really, really care about. Somebody you just really like, always there for you, you're there for, like your go-to person. And think about the last time that they were really struggling with something, that they were just really going through it. Think about how you responded to your friend in that situation. Think about what you would say and what you did. Think about the tone that you're talking to them in. And what is that like? What are you saying? What are you sharing with that friend? It's going to be all right. Yeah, some reassurance. I'll be there for you. We got this. Right? I understand what you're going through. I know this is really hard right now. So think about now times when you felt bad or that you're struggling and you're just really going through it. How do you typically talk to yourself? There's some laughing in the room. What's funny? Is there a difference in the way that you're doing that? Yeah. What are you saying to yourself? I feel lousy. I wish I felt better. How long is this going to last?
Nobody cares.
Nobody cares. Yeah. Oh, buck up and get over it. Yeah. Gotta get it done. Come on. Oh, so now picture yourself saying those things to that person that you were imagining. Like, would you say, like, buck up and get over it to whoever you were? Like, no, we wouldn't do that. So why do we do that to ourselves? We got to push ourselves, but not anybody else, right? Why is it one-sided? You're right. So this is just what we do. We push ourselves and we hold ourselves to different expectations that we hold other people to. We expect ourselves to be these superhuman humans, right? When we're all just really humans. And being human is fine, right? It really is. So self-compassion is really about figuring out how to talk to yourself the way that you would talk to someone that you very much care about, right? It sounds so simple, but it's a bit revolutionary because we don't do it. And we know that if we're talking down to ourselves, if we're criticizing ourselves, we are pushing ourselves down, pushing ourselves down, pushing ourselves down. We might think it's motivating, but we're not pushing ourselves forward, we're pushing ourselves down, right? So again, seems simple, it's really revolutionary. And there's wonderful research, Kristen Neff out of the University of Texas at Austin has a wonderful book called SelfCompassion. So if this is speaking to you, please check it out. She's also got a website, selfcompassion.org, that has a number of mindful meditations specifically for self-compassion that I find just really helpful. And we'll do one of those here in just a little bit. So what self-compassion boils down to is acting towards yourself when you're suffering the same way that you would act towards someone who you love when they're suffering. It's about self-kindness. It's about practicing and recognizing common humanity, knowing that everybody that is a human is going to experience pain, right? We're going to experience suffering, okay? Some more than others, absolutely. Certainly some more than others on certain days. But none of us are immune to suffering and pain. And the third part of self-compassion, what do you know? It's mindfulness, and we already know all about that. So that's pretty cool, right? So really it is bringing all those things together, and it's really big on that part of mindfulness about self-judgment, right? And trying to avoid self-judgment. Okay. So we're going to do a quick practice that combines meditation, mindfulness, and self-compassion. And like I said, nothing really is going to be required of you other than to listen, to be present. If you notice yourself drifting away, you notice your thoughts slipping away, That's okay. Again, our brain is supposed to do that. It's just a reminder to come back to the now. That's all, okay? I mentioned earlier that people assume that meditation, or the number one thing, the number one pushback I get when I say, hey, let's try some meditation is like, I can't clear my mind, right? I am not asking you to clear your mind. I don't even know if that's a thing that's possible, okay? So with mindful meditation, we're not clearing our mind, we're paying attention to what's there, okay? And we can notice it, and we don't judge it, we just notice it, but we can just be like a fish. We can be a fish swimming. Okay, so you can picture yourself as a fish swimming by these hooks that are your thoughts, that are your emotions, and guess what? You have the choice of whether you're going to bite on that hook or not. You know, keeping in mind what happens if we bite on that hook. We're gonna get caught, right? We're gonna get yanked out of where we're at, and that's okay. So if we can visualize those things that might be intruding on us a little bit as hooks, and us as fish, we're just gonna swim right on by, okay? So my hope is that you can take this guided meditation with you a little bit. You'd be able to find it on Kristen Neff's website on SelfCompassion.org. And this is one that I like to use with scleroderma patients and people with chronic illness, and specifically with pain, because it is all about sending compassion to our bodies, which sometimes get really cranky with us, and we get really cranky with them, right? So we're going to try to repair the relationship a little bit and do just a quick compassionate body scan, okay? So the way that we prepare for a meditation is just to get comfortable. Some people are more comfortable sitting. Some people like to lie down. Anything you want to do is completely fine. Some people feel very comfortable closing their eyes. Some people do not want to be in a room with people and have their eyes closed. Totally fine. If that's you, then you can just pick a spot on the floor to focus on and just kind of let your gaze relax to a certain spot on the floor and focus on that while I'm talking. So decide how you want to position yourself. You can sit on the chair with your back upright and relaxed, really however you're going to feel comfortable. And once everybody's a little bit situated, we'll start. And I just want you to start getting in touch with your body. How it's feeling right here, right now, present moment. See if you can feel the weight of your seat on the cushion. And just notice the entire field of body sensation. What's happening in your body right now? Maybe you're feeling some tingling, numbness, heaviness, pressure, prickling, lightness. Just notice any of that you're feeling. Feeling your body just as it is right now. And what we're going to be doing is moving our attention and our awareness to different parts of our bodies, starting at the crown of our head. And as we go through the different parts, we're going to try to give ourselves compassion for any pain or any tension we might feel there. We might also notice we're experiencing some shame or some inadequacy in certain parts of our body. And if you notice that, we're going to give ourselves compassion around that too. And that might feel like, wow, my wrist is really hurting today. I'm sorry, wrist. You know, but thank you for, being able to turn the doorknob or being able to turn that shower faucet this morning. Thank you for that. Okay. Noticing what your body is doing versus what it is not doing. So let's start at the crown of your head and just notice what sensations are there. See if you can tune into that point that's just between the air above your head and where your skull starts. And pay attention to any feelings that you're feeling right there. And resist the temptation to move to any other parts of the body right now. Just focus on your head. Now try to become aware of your facial muscles. We literally have hundreds of muscles in our face, and they work very hard for us. It's their job to express emotions, whether they're happy or whether they're very painful. And if you feel any tension or stress in your facial muscles, try relaxing them and soothing them. Maybe you can imagine caressing your face with your awareness, just being grateful for how hard our face muscles work for us, how much they communicate with other people. And now become aware of the back of your head. Any sensations there? If you have any sort of headache or pain, just being kind and tender and compassionate to the fact that you aren't feeling as well as you'd like right now is helpful. If you're not feeling any sensation there, just feel whatever's happening right now. Now think about how your neck feels. Any pinching, burning, tightness. Our neck holds our heavy heads all day long. It holds a lot of tension, especially if we sit at a computer all day. So just relaxing the neck muscles and soothing and comforting any points of pain you might be experiencing. And let's drop down into your shoulders. We carry a lot of emotional tension here. We hold stress in our shoulders. And we're almost always feeling some sort of pain or tension there. So first, just notice what you're feeling. What is that sensation like? It might be hot or cold or tight or stabby or dull. Just take a moment to feel compassion for the stress of being shoulders in your body. They really take a lot on for us. And just soothing, comforting any feelings of pain or discomfort that you might have. And now drop down so you're aware of your upper back and your shoulder blades. Again, feeling any tension that's there, any discomfort. And just allowing it to be as it is. Hot, cold, sharp, soft. And using our awareness to acknowledge any pain. And soothing that area of the body. You might want to imagine getting a little bit of a massage on your shoulders. And now become aware of your chest area. That's the seat of our heart. We so often feel our emotions right there very intensely, especially very difficult emotions like grief or disappointment. Those are physically manifested in your chest. What's that sensation like? It might feel like moving or buzzing. It might feel tight. Comfort yourself for any pain you might be feeling in your chest. If you're feeling discomfort, take the same attitude with your awareness. Just offering care and comfort. Now focus your attention on your stomach area and your gut. A lot of difficult emotions get stored here, including fear. Many of us have judgment about our stomach. Maybe it's not quite as functional as we would like it to be. Maybe it's not as thin as we would like it to be. We're just going to focus on the actual sensations, noticing the movement, tension, any physical discomfort. If there are feelings coming up of inadequacy or non-acceptance, remind yourself to be exactly who you are in this moment. And whatever arises, try to take a calm and comforting, loving stance towards this part of our body that we have such a difficult relationship with. Maybe even sending some appreciation for a fairly hard task of digesting our food and allowing us to be alive. Just relaxing and softening. And then turn your awareness towards your lower back. Very big muscles there that need to keep us upright. And if you feel tension, try to relax that part of your body and consciously soothe and comfort any pains or aches you might feel. It's hard to be in this human body with its limitations, and we can be kind to ourselves in these moments. And you can take a deep breath, and that gentle breath will bring us back into the room, into the present. As you feel comfortable, you can take a breath. Maybe you start feeling your fingers moving again. Maybe you wiggle your toes. As you're comfortable, open your eyes and come back to this space. And stay in awareness of this magnificent and yet sometimes very dysfunctional body that we have, and having compassion for its pains and still appreciation for its wonder. So congratulations, you have all just mindfully meditated in a self-compassionate way. How did that go? What do y'all think? What's that? It was nice? Okay. Being tired, it's like, yeah, you just kind of get to melt and let go, and we forget, especially at conference, it's like, I gotta be here and this, I gotta do this, and I wanna learn all this stuff, and right, so we're like this. So taking a second to settle into it, to really appreciate some of that information, and just doing this mindful meditation, we know it's gonna help improve our concentration and our attention, right? So that was maybe 10 minutes. We did about half of our body. Okay, you can certainly do the rest of your body. That takes about 20 minutes. But really, if you're doing this, you can go along at your own pace. And if you have certain areas of your body that cause you more pain, maybe that you have a tougher relationship with, spend more time there. Send it more compassion. Maybe one day that's your gut, maybe another day that's muscle aches. Does it seem a little hippy-dippy woo-woo that this is helpful for pain? Does it seem believable? Where are y'all at with that?
Very much so.
You can get your mind on other things. Yeah. It's what? Sorry? Cluttered. Yeah. We store so much stuff up there. And then because it is so cluttery, we can't find the stuff when we need it. Right? So meditation is helpful with that also. And I think meditation can be helpful because it feels distracting a little bit, and it can feel distracting from pain. And I've worked with people who have told me, like, after we finished that meditation, like, oh my gosh, I didn't realize I wasn't in pain while we were doing that. And so this is a really wonderful tool. Again, practice makes better because we're changing our brains. If we have 5 decades, 6 decades of thinking a certain way, our brain is so good at thinking that way. And it's going to take us a while to build up these other ways of thinking. But it happens, and our brain changes for it, which I think is fascinating and relieving and wonderful.